Exposure therapy is a type of psychological treatment designed to help people confront their fears. It works by gradually exposing someone to the object, situation, or thought that causes them anxiety. This process allows them to reduce their fear response over time. The idea is to teach the brain that the feared object or situation is not as dangerous as it seems. Exposure therapy is commonly used to treat anxiety disorders, phobias, post-traumatic stress disorder, PTSD, and obsessive-compulsive disorder, OCD. The goal is not to eliminate fear entirely, but to help individuals manage it so it no longer interferes with their daily lives. Exposure therapy has its roots in behaviorism, a branch of psychology that focuses on observable behaviors and how they are learned. It developed in the mid-20th century as psychologists studied classical conditioning, which is the process by which people associate a specific stimulus with a particular response. A key figure in this field was Joseph Wolper, who introduced systematic desensitization in the 1950s. This technique combined gradual exposure to a fear with relaxation training to help reduce anxiety. Over time, exposure therapy evolved to include more direct approaches, such as flooding, and became a cornerstone of cognitive behavioral therapy, CBT. Exposure therapy typically follows a structured process, which ensures that the individual feels supported throughout their treatment. The first step is assessment and planning, where a therapist works with the individual to identify their specific fears and create a hierarchy of anxiety-provoking situations. This hierarchy ranks fears from least to most distressing. The second step is education, where the therapist explains how exposure therapy works and why it is effective. They discuss how avoidance of fears reinforces anxiety and how gradual exposure can break this cycle. The third step is graded exposure, where the person starts with the least threatening situation on their hierarchy and gradually works their way up. For example, someone afraid of dogs might first look at pictures of dogs, then watch videos, and eventually meet a dog in person. The final step is evaluation and maintenance, where progress is reviewed and strategies are developed to help the individual manage any future fears or relapses. Now let's look at some examples of how exposure therapy is applied. For someone with a fear of flying, exposure therapy might begin with watching videos of planes, then visiting an airport, and eventually taking a short flight. Each step is practiced until the person feels less anxious before moving to the next one. For individuals with social anxiety, exposure therapy might involve role-playing social interactions, gradually building up to speaking in front of a group or attending a large gathering. In cases of OCD, exposure therapy might involve exposing someone to a situation that triggers their compulsions, such as touching a doorknob without washing their hands afterward. Over time, this helps them resist the urge to perform the compulsion. However, exposure therapy is not without its criticisms. One criticism is that it can be highly distressing for some individuals, especially during the initial stages. Facing one's fears can provoke intense anxiety, and not everyone feels comfortable continuing with the treatment. Another criticism is that exposure therapy may not address the underlying causes of the fear or anxiety. While it helps reduce symptoms, some argue that it does not explore deeper emotional or psychological issues, which may require additional forms of therapy. A final criticism is that exposure therapy may not be effective for everyone. Some individuals may not experience significant improvements, particularly if their anxiety is rooted in complex trauma or other coexisting mental health conditions.